Hello, how are you? My name is Nerima Were and I work with Kelin Kenya with the Sexual and Reproductive Health and Rights thematic area. I'm joined here by my colleague Alan Meleche, with whom we co-wrote an article for the Harvard Law School Bill of Health blog around the measures around the COVID-19 pandemic and how far is too far when trying to secure public health but protect the rule of law. So Alan, can you tell us a little bit about the article we co-authored?
Thanks, Nerima. Happy to have this conversation with you today. The article largely talks about what are the measures the state has put in place legally with regards to the COVID-19 pandemic, and the article zeroes in particularly on the public health regulations, mostly those that curtail the movement of people from one place to another, between one county to another, curtail the movement of people between 7 p.m. and 5 a.m. in the morning, but also made it mandatory to wear a mask, to keep social distance, and to follow many other regulations. In this particular blog, we highlight the fact that there's been excessive use of law enforcement, and also the fact that the state has actually taken a punitive approach towards implementing public health measures, and this has then taken away the trust from the public, because then the Ministry of Health has abdicated its duty to the police in terms of ensuring that public health measures are enforced by the police. Many of these measures, as I said, are captured in regulations, but the paper highlights the fact that no public participation took place, and even where it was done, little information was taken into account from different stakeholders around what the government should do. And so they ended up with having regulations that were one-sided, did not balance with the constitutional measures, and even going forward, the enforcement has also been one-sided, seeing the Ministry of Health abdicating its role to the police, and the police also abdicating some of their roles to the Ministry of Health, which has led to low trust by the public on this issue. So that's what the paper highlights, but there are more other issues around vulnerable populations. I'll turn back to you to eloquently speak to those ones.
So before we go to the issue of vulnerable populations, I would like to ask, around the punitive measures and the use of the police within this pandemic response, can we draw any lessons from any other pandemic responses?
I think we have a lot of lessons to draw from the HIV and TB responses, where the HIV and TB responses taught us that when you have a public health threat of a bacteria or a virus, using criminal law, using criminal sanctions will only drive people underground. Unfortunately, in Kenya and in many other countries, including India, including Tanzania, including Uganda, we have not seen such measures learning from what we've learned from the HIV response, what we've learned from the TB response, and what we learned from West Africa on the Ebola response, and also in our Democratic Republic of Congo. So there are many lessons to learn around stigma, discrimination, lack of use of criminal laws, but it seems like many countries, many states, many regions are just going forward as if Ebola never happened, HIV never happened, TB never happened, and there's nothing that we can learn from it. Yet there's so much richness in terms of using a rights-based and people-centered approach to build trust in people to be able to fight this pandemic.
Yeah, thank you. And I think one of the very key lessons we learned from the HIV response specifically was the issue of vulnerable and key populations. And this is also coming out with regards to the issue with the COVID-19 pandemic and its response, and who's being made vulnerable and who will sink deeper into vulnerability as a result of the pandemic response. So it's not just the disease that's problematic, also how you try to manage it can also lead people to vulnerability. And I think with the COVID-19 pandemic, we've noted women and children are particularly vulnerable, not to infection, but to the measures and the responses put in place that might mean that they might be more likely to, or might not have access to services. Children might be more susceptible to violence in this time. Women, who are majority of the healthcare workforce, being the majority of the nurses, might be more likely to be infected because of their contact with possibly people with COVID-19. And women within the informal sector are also affected by stay-at-home directives when they can no longer earn. So ensuring that both a disease and the response are considered in terms of who it makes vulnerable is very important. And those are some of the things that this article looks at. And I think, do we have any parting shots for our viewers or our listeners, Alan?
I think the parting shot for our listeners would be take time to read our blog, and for the common wananchi, kama unapata shida ya haki zako, tafadhali wasiliana na Kelin, wasiliana na wenzao wa Kelin kwa hii barua pepe, kwa hii namba ya simu, na kwa hii namba ya kutuma SMS ama ujumbe kwa ufupi. Tungependa kuwasaidia kama umedhulumiwa ama umeona mtu ambaye amedhulumiwa kwa sababu yuko na COVID ama hajapata matibabu ama kupata haki yake ya afya. So please take time to read our blog and please share it because it may help someone else in a difficult situation.
And thank you for listening.